A drive to improve assessment and treatment for patients in Scarborough was launched by NHS North Yorkshire and York in 2007. Musculoskeletal assessment clinics were introduced in the area to improve specialised physiotherapy services. One patient who's felt the benefits already is Anne Hydes, seen here receiving treatment from her physiotherapist, Siobhan Taylor.
I'd had back pain for quite a while, a few years actually, but it had got worse and I was having pain down my leg now. So I went to the doctor and he said that I would need to go for a scan to see exactly what was going on. So that was a couple of weeks. I went to the mobile unit that they had at Scarborough Hospital, and the results of that was another 2 weeks. And he referred me to the CATS team to tell me as to whether I should go to physio or whether I should go to see a consultant or not.
CATS, or Community Assessment Teams, make swift judgments on what course of action is best for patients. Instead of waiting a number of weeks to see a consultant, patients may be referred directly to a physiotherapy service like this one.
Previously in Scarborough, for a patient to be referred into an orthopaedic surgeon, the GP would have made a referral into the hospital, and that then would have been appointed to a consultant appointment within about 13 weeks. The streamlining that's happened involves a specialist team of physiotherapists, podiatrists and GPs who work within a musculoskeletal clinical assessment and triage service to paper triage referrals, to assess if those referrals can be seen by the team rather than waiting to see a consultant initially, and if so, they are given an appointment within the CATS team within 2 weeks. So the service is much more responsive to the patient's needs, and they can access the service in slightly different ways, which means that they get a smoother pathway, closer to home and hopefully very much faster than previously experienced.
At this practice in Filey, Dr. Phil Garnett has seen tremendous improvements in the way his patients are now being assessed and treated.
Before MSK triage was set up, you had two options. You could either refer to the local physiotherapist or to the consultant orthopaedic surgeon in outpatients. Those were the only two options available to you. Well, now all referrals go through the MSK triage, and what that actually means is that patients, first off, they're seen more quickly than they would normally be, and they see the most appropriate person for their condition, because the people who actually do the MSK triage are physiotherapists with further development of their skills and also some degree of subspecialisation. So they actually get to see the most appropriate person at the quickest possible time.
The assessment clinics have been very well received by patients in Scarborough, and there are plans to develop the service across other parts of North Yorkshire.
It was a couple of weeks to go for the scan, then a couple of weeks to get the results from the scan, then it was just a couple of weeks to see Siobhan, the CATS team. They said it was a new way of doing things, so I was quite impressed.